Good morning. I'm Michelle Corson with Kern County Public Health, and I'm here to provide a COVID-19 update and its impacts on Kern County. I would like to start again with really thanking our residents, our businesses that are adhering to the governor's stay-at-home order and practicing social distancing. If you do have to go out for essential business, we really appreciate it. We're all in this together, and all the steps we're taking now are really going to help to slow the spread of COVID-19 in Kern County. I'd like to start with the current statistics. The California Department of Public Health, as of April the 4th, confirms 13,438 cases and 319 deaths. In Kern County, as of April 6th at 10 a.m., we have 234 positive cases, 5 non-residents, and 2 deaths. For our testing, we have conducted 4,902 tests, 2,823 are negative, 1,840 are still pending. For the age categories of the tests, ages 0 to 17, 3 cases. Ages 18 to 49, 123 cases. Ages 50 to 64, 71 cases. And ages 65 and older, 37 cases. 26 of Kern's positive cases have been hospitalized at some point during the course of their illness. We update this number on a weekly basis. We provide an update every Friday. The Centers for Disease Control has guidance for releasing positive COVID-19 patients off of home or hospitalization. This is an indicator that patients are no longer infectious. So far, 33 people have met that criteria and are no longer in isolation. That also is a number that we update once a week. I'd like to talk about face coverings now. On Friday, April the 3rd, the Centers for Disease Control announced their recommendation for wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain, like a grocery store or a pharmacy, and especially in areas of significant community-based transmission. Additionally, the California Department of Public Health has released guidance related to face coverings. This is simply guidance. It is not a mandate. The guidance specifically stated that there may be a benefit to reducing asymptomatic transmission of COVID-19 by wearing face coverings. However, our best community and individual defense against COVID-19 is washing our hands frequently, avoiding touching our eyes, and practicing social distancing. If you do choose to wear a face covering, it is a good idea to wash your face covering frequently, ideally after each use, but at least daily. Have a bag or a bin to keep soiled face coverings in until they can be laundered. Launder face coverings with detergent and hot water and dry them on a hot cycle. If you must re-wear your cloth face covering before washing, wash your hands immediately after putting it back on and avoid touching your face. I'd like to now talk about the governor's order regarding essential and non-essential businesses. To date, Kern County Public Health has received over 300 complaints and has responded to over 150 complaints of local businesses that remain open despite the governor's order. A follow-up of inspections of facilities resulted in one law enforcement citation issued by the Bakersfield Police Department under the health officer order to a local gym. We will continue to receive your complaints and follow up on them on a weekly basis. There is a link to a map on our website and we encourage you to visit if you would like to issue a complaint, or you can always call us at in our call center at 321-3000. Finally, I want to talk about what can we all do to protect ourselves and our community from the spread of COVID-19. Social distancing is so important. Models are showing that this has the most impact on prevention. If we increase our social distancing by 20%, we decrease our hospitalizations by 74%. If we increase our social distancing by 30%, we decrease our hospitalizations by 97%. I hope you let that settle in. Social distancing is something each of us can practice, and it can make such a dramatic impact, especially on our healthcare community as well. Also, stay home. Only leave if you must for essential services. And finally, practicing those measures. I'm going to say them again because this is something we all have power over. Washing your hands with soap and water often. Clean and disinfect frequently touched surfaces daily. Avoid touching your eyes, nose, and your mouth. Cover your cough and your sneeze with a tissue or your elbow. Avoid close contact with people who are sick. Stay away from work, school, and other people if you become ill. And we want to encourage you to continue to call our call center. We're open Monday through Friday, 7 days a week, 8 a.m. to 5 p.m. to answer your questions. And visit our website. We update that daily as well at kernpublichealth.com. And now what I'd like to do, this is our second try at this, our local media, as we all continue to practice social distancing, they are going to be calling in and asking their questions remotely. So to my media friends, I want you to go ahead and hit *6, and I'm going to unmute this right now. And I would like to invite the first question from Channel 23, please. Are you there? Can you hear me? Is Channel 23 here? I have a blue light. Is Channel 29 here?
29 is here. This is Emma Goss.
Hi, Emma. Do you have a question?
I do. Thanks, Michelle. What is the guidance from Public Health on whether COVID-19 can spread to our pets? We saw the Bronx Zoo tiger did contract a positive result of COVID-19.
That's a great question. Yes, we are following that closely. The tiger that was announced to be tested positive. We are still going by the CDC guidelines where having any confirmed transmission between animal and human in the United States, up until that point, it has been noted that anytime we were around animals, we should take precautions because they always can carry germs. So to wash our hands and just be careful with general hygiene around our animals. But stay tuned because the guidance may be changing on this, so we're going to be watching closely as the Centers for Disease Control evaluates this new case. So we will bring you the information as we receive it, Emma.
Thank you.
Channel 17, are you here?
Yes, hi Michelle, this is Karen Hua.
Hi, Karen.
My question is, are you able to give a more decisive answer on whether, let's say, salons or clothing stores, retailers, are they allowed to sell curbside? Because food restaurants are allowed to, but what's the guidance on other places?
So when it comes to our businesses, with the non-essential and the essential, we first refer you, of course, to the governor's list, the governor's orders. And then what we are doing is we are going out on a case-by-case basis with these businesses. And we are addressing them if they're practicing social distancing, if they have the proper sanitizing efforts in place. So those I believe that you've mentioned are not on either list. So we would have to take that on a case-by-case basis locally.
Okay, thank you.
Of course. And now, KUZZ, are you here? Then I'm going to move ahead to the Bakersfield Californian.
Hi, Michelle. Yes, this is Stacy Shepard. My question is, the past 2 weekends, we've seen the numbers reported dip lower than what they were during the week. Do you know, is testing or the processing of tests lower on the weekends than it is during the week?
That is a great question about testing, and the answer is we monitor these. They report into us testing that occurs, but being able to give you a definitive answer that all of the hospitals have the capability of testing, the local urgent cares. So this changes on a daily basis, and more testing becomes available on a daily basis. So to give you any answer to a pattern right now that we're seeing of is there a dip on the weekends, how fast of a turnaround we're getting for some of these tests is also varying. So it's just really difficult for me to answer that question. I think over time we're going to be able to see more of an established pattern, but for now we're just too early on. So do we have Mr. Ralph Bailey here? Nope. What about Tony Lee with KNZR?
Tony Lee is here, present. Good morning.
Good morning.
Can you? Okay, I didn't know if you could hear me.
Hi.
I'm just curious about the face masks, because that is something that has now been recommended that we should all wear. Is there any place that you are aware of that these are commercially available for those who don't have the ability to make one, or who would just prefer something that is a little more designed for the purpose? Could we go someplace and buy a face mask?
So, great question. The face covering guidelines just changed on Friday. So what we're going to be doing is, first, we do have a link on our website at kernpublichealth.com. Also, the Centers for Disease Control has a fantastic website that is talking about how you can make these in your home with bandanas and T-shirts, as simple as using those products in your own home. So what we will be doing is continuing to push out these methods of how you can do it in your own home, as well as any local sources that have these products available. I'm unaware currently, but we're going to continue to get the messaging out because this was a change that just occurred. So that's a great question. Thank you.
And I had a second one, if I may.
Sure.
Do you have any estimate as to when we will see our curve begin to flatten out, or is that still too far in the future to predict?
Yes, that we're still early on in the flattening of the curve, but I want to reiterate, all the models are showing to flatten that curve, it's all about social distancing. So right now, this is critical that we're all staying at home, we're all practicing social distancing. That is how we can impact the flattening of the curve. So stay tuned, Tony. We will definitely be bringing more information as our modeling progresses, but at least we know that's the one thing we can all be doing to make a difference.
Thank you.
Of course. Did Channel 23 come? All right, I'll just open it up for a couple more questions before we wrap things up. Anybody?
Emma from Channel 29.
We'll start with Emma.
I just wanted to thank you, Michelle.
Sure.
In terms of we're seeing blood banks nationally using plasma from people who have recovered from COVID-19. They're taking in the donations, and they're trying to use those on people in hospitals who are trying to fight the virus. Is there any hope that this system of treatment might actually provide some relief in terms of the death rate?
We'll continue to follow that, Emma. It's too early for me to really comment on that, but stay tuned, and I'll report out more on that. I'll look into that and report more out on that on Thursday. So that's about all I can say at the moment.
Gotcha.
Thanks, Emma. Who was that you, Stacy?
Oh, hi, Michelle. This is Karen Hall with 17 News.
Oh, hi.
Oh, hi. My question is, those people who you said are no longer in isolation, no longer infectious, what is the protocol they need to sort of reintegrate back to work, to society? Do they need proof of results for their employer, or do you guys contact the employer?
Once someone is no longer in isolation, they are no longer symptomatic, and there is nothing that would need to be shown to indicate that. So they're under the care of a healthcare professional, and when their isolation period is over and they no longer are symptomatic, they are free to conduct themselves as the rest of us, but still practicing, obviously, all of the stay-at-home measures and things like that.
Okay, and then sort of just a second parter to that, are there any consequences if an essential employer, such as a grocery store, doesn't really take actions to protect the rest of their employees?
Well, we work very closely. Anytime there is a positive case, our epidemiologists are in contact immediately with the patient and then with any close contacts. And if that means talking to the employer, we are including them in that conversation. So we are making sure that the public is protected, that everyone is either self-isolating or doing whatever protocols need to be in place to make sure the community is protected. So we take that very seriously.
Thank you.
Of course. Well,
Michelle, this is Stacy again from the
Hi.
California, and if I could ask one more question.
sure.
Hi. So when a business identifies an employee who has tested positive, and it's a grocery store, let's say, and they contact public health, what is your guidance to them? So, we had an employee who tested positive. They were working here as of yesterday. What do you need to do?
Well, first, we are going to know a positive case, and we're going to be in immediate contact with that individual. And then we will be, again, moving to know exactly where they have been, who they have been in contact with. And again, if that's going to include a business, we're going to be in contact with them as well. And then we are going to make a determination of what steps have to be taken at that point. And it's going to vary from case to case. Had that employee been to work while symptomatic? Based upon that information, we're going to make sure that any close contacts are notified. If we can't make sure that we are in contact with all of the close contacts, that is when we would take the step to make a public notification.
And so far, that hasn't happened.
Correct. Correct. So all of our measures that we have been able to take now, we've been able to achieve by working with the business, the employee, and any of those close contacts.
And so there's no belief that anyone from the general public was exposed to any of these people, these 235 people who have tested positive.
Correct. Because if we found in our investigation that we weren't able to get with all the close contacts, we would definitely make a public notification, like we've done in the past for measles, for example. And
I'm sorry, like you've done in the past for what?
With measles.
Okay. Okay, thank you.
Of course. Well, I'm going to go ahead and wrap things up. Thank you so much. Thank you. The social distancing is working with our media friends calling in. We appreciate them so much. And again, everyone stay safe and visit us on kernpublichealth.com or call us at 321-3000 if you have any questions. Thank you.
I dial from here? Or no? Yeah. Nine. I still do the 9, right?
Hello.
Hola Norma, habla Eli, ¿cómo estás?
Bien, ¿y tú, mija?
Muy bien, muchas gracias.
Qué bueno. ¿Ya está en la entrevista ahorita? ¿Ya está?
Sí, estoy lista para tus preguntas.
Ok, perfecto. Ok, Ali, pues yo tengo algunas preguntas relacionadas con cuando una persona sale positivo en la prueba, ¿verdad? Que le dicen a la persona que salió positivo. Si esa persona ha estado trabajando con otras personas, con el público, como sea, ¿cuál le dan inmediatamente algún tipo de prueba que muestre los resultados para el empleador? ¿Se lo dan inmediatamente, Ali?
Sí, lo que pasa es que cuando una persona resulta positivo con COVID-19, nuestro equipo inmediatamente se pone en contacto con esa persona que es positivo y hace una investigación de investigar cuáles fueron sus contactos cercanos y en qué áreas estuvo durante ese proceso. Y entonces nuestro equipo contacta a esos contactos para dejarles saber que fueron expuestos al COVID-19.
Entonces no es responsabilidad del empleado avisarle al empleador, sino que ustedes contactan al empleador de inmediato.
Sí, si es necesario contactar al empleador, sí se contacta al empleador y entonces el empleador informa a sus empleados.
Esa era mi siguiente pregunta. ¿Es obligatorio que el empleador tome acción inmediatamente o de quién es la responsabilidad de decidir? Si
Es basado en el caso de cada paciente. Entonces nuestro equipo llama y les da instrucciones de cómo proceder.
Entonces depende de cada caso.
Sí.
¿Cómo qué, Ellen? ¿Dependiendo de qué?
Es que cada caso es diferente. Dependiendo de cada caso es cómo se determina cómo seguir los siguientes pasos. Nuestro equipo hace la investigación y determina de qué contactos se tienen que contactar inmediatamente. Por ejemplo, si entonces de que el caso sea de que no pudo hacer contacto, entonces esta notificación sería pública, ¿no? Entonces lo haríamos público. Pero hasta la fecha se han podido contactar estos contactos, se han podido notificar adecuadamente.
¿O que te refieres a la persona o al empleador?
A las personas, y si es necesario contactar al empleador, también se contacta al empleador.
Pero entonces es responsabilidad del Departamento de Salud contactar al empleador.
Sí.
¿Ok? Entonces mi pregunta es la siguiente. Si el empleador, cuando el empleador continúa abierto, sabiendo que una de sus personas resultó positivo y estuvo trabajando con varios empleados, si el empleador continúa, ¿verdad? Continúa abierto y ¿cuáles son las medidas que ustedes pueden tomar?
Pues hasta la fecha no ha sucedido un caso así, pero tenemos nuestro equipo de esfuerzo que iría a hacer la investigación más apropiada. Entonces seguirían los pasos. Es que es dependiendo del caso, de cómo fue la exposición, si en realidad hubo transmisión. Entonces es difícil responder a esa pregunta porque es basado en caso por caso.
Ok, entonces puede ser que alguien haya estado trabajando con varias personas y que haya público y todo, pero que se decida que realmente no tienen que cerrar la compañía o que no tienen que avisar a las demás personas?
Claro, y obvio si es necesario, si el caso es de que es necesario cerrar el negocio, entonces el negocio se tendría que cerrar, obviamente.
Pero el aviso a los demás empleados sí es obligatorio.
Sí.
¿Por parte de quién?
Salud Pública contacta a los contactos, ya sea contactos personales, contactos cercanos o el empleador, y entonces el empleador informa a sus empleados.
Ok, entonces ya por último, si alguien da positivo, le avisan al empleador y todo, el resto de los empleados no necesariamente les hacen la prueba o hasta que empiecen a mostrar síntomas únicamente.
Otra vez es basado en cada caso del individuo, entonces harían como una investigación y se determina entonces quién es requerido hacerse la prueba y quién no.
Ok, Ali, pues son todas las preguntas que tengo ahorita. En realidad son preguntas que empleados tienen sobre personas que han salido diagnosticadas y que pues en realidad ellos dicen que no les avisaron inmediatamente y pues están preocupados, obviamente.
Sí, lo que sí le queremos dejar saber a nuestra comunidad de que si alguien que resultó positivo los puso expuestos a este virus, nuestro equipo los va a contactar. Van a recibir esa llamada de nuestro equipo para avisarles de que fueron expuestos.
Ok, Ali, thank you.
Muchas gracias.